Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Massive funding cuts have been made to NIOSH, the National Institute for Occupational Safety and Health, the federal agency responsible for conducting research and making recommendations for the prevention of work-related injury, illness, disability, and death. Today, Stephanie Desmond talks to Ramachandran and Cass Krafasi, two Johns Hopkins experts who lead the school's NIOSH Education and Research Center, the future of which remains in doubt. Let's listen.
Ramachandran and Cass Krafasi, thank you both so much for joining me.
Thank you very much.
So today we're going to talk about NIOSH and cuts at NIOSH. And before we get any further than that, Ram, could you please tell me what NIOSH is?
So NIOSH stands for the National Institute for Occupational Safety and Health. And it was created by an act of Congress in 1971 to essentially protect the nation's workers from a variety of occupational hazards and occupational illnesses. One of the things that NIOSH was asked to do was to create the nation's workforce in occupational safety and health. And the way it did that was by funding these education and research centers around the country in various universities. And so over the years, now there are 18 such centers around the country, and the one at Johns Hopkins is one of them.
Mm-hmm. And it's different from OSHA. Tell me about that, Ram.
So OSHA is the enforcement wing of that same Occupational Safety and Health Act. So there are two agencies created in that act. One was, like the name suggests, NIOSH is a research institute, and it conducts research either by itself or through these universities, through grants and so on. And the goal is to develop the best practices and best technologies for achieving this goal. And then the research is then sort of used to develop, regulations that OSHA then enforces. So OSHA has sort of the legal authority to go into a workplace and inspect it and issue citations, for example. NIOSH is purely a research institute.
Just to reiterate a point that Ram made, NIOSH is often working in partnership with researchers and even with different occupational groups and industry to develop these best practices such that rules and laws don't have to be made. There are obviously standards that are created that people are held accountable to, but these collaborations can help achieve the same ends, the same prevention of injury and prevention of loss of life at a much less costly strategy.
Mm-hmm. So not to sound like a broken record, because I do feel like one, the Trump administration has made cuts to NIOSH. Cass, could you tell me what that story is?
We have seen really significant cuts to NIOSH as a result of restructuring in the Department of Health and Human Services and the anticipation of the development of a new agency that would focus on worker safety and health. The challenge is that OSHA and NIOSH together have existed, as Ram said, for more than 5 decades, and there's a lot of work and knowledge that has been created. These cuts have absolutely decimated NIOSH. Between 2/3 and maybe even more than 90% of the workforce, depending on the section of NIOSH that you're looking at, have been eliminated. And this means that we are having a much harder time doing that research and making the recommendations. Also, we are thinking about the implications now for worker safety and health, but we're preventing the training of the future workforce that is going to be doing this work to keep our workers, who are really integral to the function of our country. We're not going to have the workers and the researchers needed to be able to improve safety and health.
So, Ram, what will we see as this plays out?
Yeah. So let me just give you one example. So in 1970, around 38 workers die from work-related injuries every day in American workplaces. So today we have reduced that to 15, so by more than a half. So that is the effect of these occupational safety and health laws and regulations and best practices that Cass just mentioned. So that is the effect of having such an infrastructure in the country. And let me also just say, this comes at a very, very small cost. So the annual budget for NIOSH is around 330 million. And so all the ERCs put together, their budget is about 32 million. And so it's really the 32 million is part of that 330 million. So it's a very small amount. And to put that in perspective, I like to use this example. NIOSH conducted this study to look at road construction workers' exposure to road dust, silica dust. And silica is a well-known respiratory hazard, causes this disease called silicosis, which leads to potentially death after a long disease. And just this one program they did to reduce road construction workers' exposure, that resulted in reductions in risk and benefit and led to a benefit of 690 million per year. And this was just one small program that led to a benefit of more than double of NIOSH's annual budget. And so the return on investment in workers' health is tremendous. And so that's why we feel like, this is a no-brainer. I mean, this is not like controversial. These are the nation's workforce, and the administration wants to bring back construction and manufacturing and everything back to this country. Why would you not invest in the workers?
Cass?
To Ram's point, I was just going to emphasize that we really are seeing this push to bring back manufacturing at the time we are now decimating the agency that would help keep these workers safe. But another important point that folks might not know is that NIOSH also certifies safety and health products that are sold as personal protective equipment, both in the US and in other countries. So if these products by companies like 3M or other manufacturers here in the US cannot get certified, it is going to be much harder to then sell them internationally, which is further going to hurt the US economy.
So COVID masks, for example, I think you go on their website to find out if they're certified. Isn't that right?
Exactly. Yeah. So N95s or other kind of masks that you might wear, whether it's for COVID or if you're a healthcare worker and you may be treating a patient with pneumonia or some other respiratory disease, if these products can't get certified, they can't be sold anywhere. And that's really going to impact worker health, but also the economy.
So, Cass, what kind of research are you doing in NIOSH?
So we have trainees, as well as the work that we have done that really focuses on workplace violence, which is a really important source of worker injury and safety risk. And so thinking about how employers regulate access to firearms in their workplace. And we see that if it's really easy to access firearms in a workplace, we see more people being shot and injured. We also see that when you make it easy to access firearms in the workplace, many more people are injured or killed when an incident of violence occurs in the workplace. And so our work has focused a lot on some of that worker safety and health. We've also trained people on the ethics of data privacy and safety. We have a recent trainee who graduated who was focused on when we use wearable technology, for example, like a Fitbit or an Apple Watch. When those are part of a worker safety and health program in a job, what kind of data protections do people want? What kind of information are they comfortable sharing? Because we think about how much time we spend in the workplace, how much exposure we have to the things there. And so thinking about how we're mitigating safety and injury risks, how we're thinking about exposure to violence, those are just a couple of examples of the kind of work that we're doing on the occupational injury side.
Mm-hmm. Ram, your center, remind me, is called?
The Johns Hopkins Center for Occupational Health.
Has your center been cut by these recent funding changes?
So that's an interesting question because we don't know. And part of the reason we don't know is NIOSH itself has been cut by more than 85%. So around 85% of the around 1,400 staff, scientists and other staff, have been cut. And so this includes the staff within NIOSH that manage our budgets and so on their side. And so nobody has been able to tell us whether or not we have been cut. So we assume that we are going to be cut because NIOSH essentially funds our centers, but the cuts have been so quick and so sort of chaotically done that we don't even know whether we have been cut or not. There's nobody there to tell us.
Wow. So what kind of research do you do, Ram?
So my own work is in assessing workers' exposures to hazardous substances in the workplace. So mainly airborne, but other types also. So airborne chemicals, airborne dusts. I mentioned silica dust, for example, earlier. So that is one thing I work on. And what is the right sort of, on a more sort of theoretical end of things, how is the strategy for assessing these exposures and sort of the proper statistical strategies for these things? So a variety of things, but all focused around assessing exposures of workers.
Mm-hmm. So like in really practical terms, Cass, what could workers see that is different?
I would expect workers to see less collaboration to develop best practices and recommendations for workplace safety and health, perhaps less availability of the very protective equipment that they need to be able to safely do their jobs. And I think at a minimum, a lot of confusion. As Ram said, there's no one there to answer some of these questions. And whether it's workers sort of on the ground day to day, unsure of what they should or shouldn't be doing or what products are available to them, all the way up to some large research institutions not knowing if they still have their funding.
So, these ERCs, they do three things. One is, of course, training master's and doctoral students who then go on to be employed by various companies in their occupational safety and health departments. The second one is we provide continuing education services to companies. And so if you are a professional working in a company and you want to brush up on something or there's some new hazard that you want to learn, so we have like these short courses that we provide on emerging threats, for example. So we did a bunch of these during COVID on these masks, for example. And so those kinds of trainings are going to be immediately lost. So that's an immediate thing that workers and occupational safety and health employees in companies will no longer have access to.
Mm-hmm. Is there any hope, Ram, that this could be reversed?
We can always hope for things. And, we do really important work. And it's not a Republican or Democratic issue. This is a bipartisan issue. And there's a lot of bipartisan support for the work that NIOSH and these centers do. So I'm hopeful that this can be turned around. There was an initial wave of cutting without understanding what different agencies actually do. But there's a lot of pushback by supporters of NIOSH, supporters of worker health. And I'm just keeping my fingers crossed.
Cass, the last word.
I would like folks to be optimistic. I think if we become pessimistic or assume it's a done deal, we make it a lot easier for NIOSH to just be cut. So I think we've really been working strategically to educate policymakers about what NIOSH does and the important role that it plays in not just worker safety and health, but in a robust U.S. economy. So I'm hopeful that we can continue to convince folks to reinstate funding at NIOSH.
Cass Krafasi, Ram Ramachandran, thanks so much for joining me.
Thanks for having us.
Thank you very much, Stephanie.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Sasiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.